Bipolar disorder is one of the most misunderstood mental health conditions. It's often portrayed as just mood swings or confusion between happiness and sadness. But bipolar disorder is far more complex, far more serious, and far more human than what most people think. This condition doesn't just affect someone's mood. It can alter their entire sense of self, their relationships, their ability to work, to function, and even to hope. Today, let's cut through the stereotypes and surface-level definitions. Let's take a deeper look at what bipolar disorder actually is, what it feels like, the different types, the symptoms, and how it affects real people living real lives. 1. What is bipolar disorder? At its core, bipolar disorder is a mental health condition that causes extreme shifts in mood, energy, activity levels, and behavior. These aren't ordinary ups and downs. These are intense highs called mania or hypomania, and deep lows known as depression. People with bipolar disorder may go from feeling invincible and euphoric to completely exhausted, hopeless, and numb. Sometimes within weeks, sometimes days, and occasionally even within hours. It's not about being emotional, it's about the brain regulating mood in a completely different and often erratic way. 2. The main types of bipolar disorder. There isn't just one kind of bipolar disorder. The condition actually exists on a spectrum, and different people experience it in very different ways. The main categories include Bipolar I disorder. This involves full manic episodes that last at least a week and often require hospitalization. People may also experience major depressive episodes, but even if they don't, just one full manic episode qualifies for a bipolar I diagnosis. Mania here can become extreme: delusions, psychosis, reckless behavior. It can be dangerous. Bipolar II disorder. This type includes hypomania, which is a less intense form of mania, combined with major depressive episodes. Hypomania might look like productivity, high energy, charm, and confidence. But it can still disrupt life, and the depression in bipolar II can be even more debilitating. Cyclothymic disorder, a milder but longer-term version of bipolar. People experience chronic mood fluctuations, mild depression, and hypomanic symptoms that persist for 2 years or more. But they never meet the full criteria for either mania or major depression. Still, it can cause serious emotional instability over time. 3. Symptoms. It's more than just mood swings. The symptoms of bipolar disorder vary depending on whether someone is in a manic, depressive, or mixed state. And contrary to popular belief, it's not always easy to recognize. During manic episodes, a person might feel overly confident or euphoric, speak rapidly, jump between ideas, sleep very little but still feel energized, make impulsive decisions, spending sprees, risky sex, quitting jobs, experience grandiosity, feeling chosen, unstoppable, or godlike. Sometimes develop delusions or hallucinations. During depressive episodes, the same person may feel empty, hopeless, or deeply sad, struggle to get out of bed or function, lose interest in everything, even things they once loved. Think about death or suicide, feel worthless, guilty, or disconnected from reality. Mixed episodes, where symptoms of both mania and depression occur simultaneously, are especially dangerous. Imagine feeling suicidal, but also restless, agitated, and unable to stop your racing thoughts. It's chaos, and it's terrifying. 4. What it really feels like. For those who live with bipolar disorder, it can feel like you're constantly fighting your own brain. During manic phases, life may feel thrilling. Thoughts come fast, ideas flow. Everything seems possible. You may feel inspired, energized, magnetic. But beneath that rush, there can also be recklessness, irritability, or aggression. Relationships get strained, mistakes pile up. Then comes the crash. Depression isn't just sadness, it's a complete loss of self. People describe it as being hollow, drowning, or invisible. Simple tasks feel impossible. Time feels slow. Guilt sets in, and sometimes the only relief from that pain seems unthinkable. That's why suicidality is alarmingly common in bipolar disorder. What makes this condition so brutal is that many people remember how powerful and alive they felt during mania. So even though it hurts them, they crave that version of themselves. The constant swing between these emotional extremes can leave a person exhausted and confused about who they really are. 5. Causes and triggers. Bipolar disorder doesn't have a single cause. It's believed to be a complex mix of genetics, brain chemistry, and environmental triggers. If you have a parent or sibling with bipolar disorder, your risk increases. Traumatic events, major life stressors, substance use, or even sleep disruptions can trigger episodes. It's important to note, bipolar is not a choice or character flaw. It's a legitimate medical condition, and nobody brings it on themselves. Like any chronic illness, it requires ongoing management and understanding. 6. How it's treated. Bipolar disorder is treatable, but it's not curable. Most people require a combination of medication and therapy to manage the condition long-term. Mood stabilizers like lithium are often prescribed to prevent extreme highs and lows. Antipsychotic medications may be used during severe mania or mixed episodes. Antidepressants must be used with caution because they can trigger mania in some cases. Psychotherapy, especially CBT, cognitive behavioral therapy, helps individuals recognize patterns, build coping tools, and strengthen their relationships. Lifestyle matters too. Consistent sleep, avoiding drugs and alcohol, stress management, and having a strong support system all play a role in stability. The goal of treatment isn't to suppress emotion, it's to create balance, enough stability to live, work, love, and feel human again. 7. The stigma and the silence. One of the hardest parts of living with bipolar disorder is the stigma. People may get labeled as crazy, unstable, or dangerous, when in reality, they're often highly intelligent, creative, empathetic individuals fighting an invisible war. Many hide their diagnosis out of fear of rejection, job loss, or judgment. That silence can make the illness even harder to bear. Raising awareness, with compassion, not caricature, is how we help people heal. Understanding bipolar disorder isn't about giving pity. It's about giving space, patience, and respect to people whose experience of the world is simply different. Conclusion: bipolar disorder isn't a flaw or a failure. It's a serious, often lifelong condition that impacts millions of people. People with families, dreams, talents, and dignity. They're not crazy, they're fighting every day. If you or someone you know is living with bipolar disorder, know this: you're not alone, you're not broken, and with the right support, there is a path forward. Stability is possible. Peace is possible. Life is still yours to live. If you found this video helpful, then be sure to like and subscribe.